Thanks very much. And just before I start, I'd just like to thank Professor Philip Larkin, my supervisor, Our Lady's Hospice, and the participating community palliative care nurses for helping me with my research. It's actually hopped forward, I think. There we go. So the title of my research is Community Palliative Care Nurses' Experience of Resilience in Their Work. Although I'm specifically talking about community palliative care CNSs, I do hope that a lot of this will resonate with anybody who's working in palliative care. So to start with, to define resilience, it's the ability to bounce back in the face of adversity. So it's learning from difficult situations and recovering through positive adaptation. It's a little bit more than coping, in that coping can be positive or it can be maladaptive. So for example, if you've had a very stressful day, your way of coping with that may be to go home and have a bottle of wine. It may help you on the day, but it doesn't necessarily prepare you for a similar stress in the future. The literature on resilience and nursing largely focuses on analysing resilience as a concept and factors that influence resilience. And there's no specific measuring tool to the healthcare setting because of the multifactorial and complex nature of resilience. But when you boil down all the literature, basically resilience comes down to 4 particular areas: personal characteristics, relationships, external personal circumstances, so what's going on outside of the workplace for the individual, and then environmental and workplace factors such as staffing levels or resources at work. Don't know why this is hopping on me. So just to say a little bit more about the personality factors. These ones here, okay. The personality factors that are thought to enhance resilience in nurses. So the ability to cognitively appraise a challenging situation and view events realistically. That's been able to manage expectations and set realistic goals. High self-efficacy is very important. Having the self-belief and self-confidence, to have autonomy and control, to have good problem-solving skills, resourcefulness, and to be able to be flexible. And a lot of this will make sense when I present my findings. Having the ability to cope with change and re-establish equilibrium, and we've talked a lot about change here today. Finding meaning and purpose in your work, and emotional awareness and the ability to reflect. Within palliative care itself, only 2 studies to date have specifically looked at resilience in palliative care nurses. One of them was a UK study which focused on inpatient nurses, and one of them was in Japan, and again it was inpatient nurses. O'Mahony et al. In 2017, when exploring compassion fatigue, suggests that the stresses that community palliative care professionals experience are probably a little bit different to what their counterparts in the inpatient system, in the inpatient service experience, because support systems are a little bit more fragmented. So my study design then, I used a qualitative approach because I wanted to explore resilience from the point of view of those experiencing it. I used semi-structured interviews, and I used a topic guide just to ensure consistency but allow free expression. I used a purposive sample of community palliative care nurses in an urban setting, none of whom I was working with at the time, and I achieved data saturation at 8. And I used Braun and Clark's 6-phase approach to analyse my data. Just looking at the participants' profile, all of the nurses were very experienced with a minimum of 5 years experience in palliative care, and all held a higher diploma, a minimum of a higher diploma in palliative care. So 4 main themes emerged from the data. The first one was commitment to doing the best you can. This is what sustains the nurses in their daily practice. All of them chose to work in palliative care and derive great job satisfaction from making a difference to the quality of their patients' lives. And many of them had come into palliative care because they've found there was a deficit in their own knowledge, and they had had previous experiences of looking after palliative care patients, and they felt a little bit at sea at the time. All of them spoke about the rewarding nature of their work and their ability to make a difference. This supports findings of Ablett and Jones and Gillespie et al., where finding meaning and having the self-belief that you can influence situations enhances resilience. Sometimes in the community, things don't, and in palliative care in general, things don't always go as you would like, and circumstances aren't always ideal. And we talked about patient choice and respecting patient choice. And these nurses acknowledge that it's not always possible to make a difference, and they can accept that once they've done the best they can. I knew there were certain difficulties, but when I was faced with them that evening, letting myself into the flat to find this man in a bed who couldn't do anything for himself, quite happy in his situation, but very stressful for us caring for him. This was about a gentleman living on his own, and the feelings of the nurse as she had to leave that flat that day. Another situation, a nurse described, we wanted to bring him into the hospice and he didn't want to come in. We had a checklist in our own heads that this would be the best for him, but he had his own ideas. Once we spoke as a team about him, tried to maximise what we could do for him at home, the whole thing became easier, and he did die at home, and that was what he wanted. Once we changed our thinking on it, it went the best it could be, but I suppose to be respectful of his decision, and that was his wish, and I suppose he did connect with us a lot more then. One of the core qualities of resilience is to be flexible and able to adjust and problem solve. And I suppose from these quotations, you can see the flexibility of these nurses and how they were able to problem solve and adjust their plan of care according to the circumstances. It would seem that they seemed to experience less stress when they could accept they were doing their best in the circumstances, as this illustrates here. The second theme then was feeling confident in the role. And there's 2 strands to this, role clarity and competence. An important feature of resilience, as I had said earlier, is self-efficacy, confidence in one's own ability, well-developed problem skills, and knowing one's own limitations. And, you know, having role clarity really helped these nurses to manage their frustration and to manage conflict in the working day. So I suppose it's being about aware of what our role is, what I'm capable of doing, and what's relevant to us, and what's relevant to maybe the public health nurse. I find that helpful. A second strand to role clarity was that others, as in patients, families, and other healthcare professionals, would have role clarity as well about what the community palliative care CNS does. And if there isn't clarity, that leads to frustration and can lead to reduced resilience in the nurse. This is examples of this. Recently, somebody's expectations were that we should have a 24-hour service. So every day we were bombarded with that, and every day I came out of the house feeling frustrated and angry. You sometimes have to work hard at drawing in the GP and public health nurse, and that can be stressful. They're so busy in their own clinical settings that they do rely on palliative care and can be quite willing to let palliative care manage all the care. Competence then. It's the ability of a nurse to carry out his or her professional obligations within their scope of practice. All of the nurses in this study emphasised the importance of their nursing experience and their life experience in helping them in their daily work. They also spoke about the importance of their education, both formal and informal. They learned from each other, they learned from patients, and they emphasised the importance of a good skill mix on the team. One nurse talked about 2 very experienced colleagues who had retired, people that she would have turned to for their experience. And it just shows that really when there is any kind of a change in the team, it can impact on the resilience of the nurses on that team as well through loss of experience. The third theme is self-care, and that's self-management at work and work-life balance. Many of the nurses acknowledge the fact that they can encounter a lot of chaos during the day. So they felt it was important to be able to have some element of the day where there would be calmness. And they talked about, you know, the office environment, important for it to be calm there. The car journey seems to be a very therapeutic, it serves a very therapeutic service to these nurses. It allows them time to contemplate, relax and debrief after a visit, and to gain perspective and think more clearly about events. They can also have the opportunity to have a safe haven to phone someone if they're concerned or if they have things that they want to debrief about, and it helps them bring closure before their next visit. All nurses had developed strategies to help them re-establish equilibrium after a busy day, and these are some of the examples of the things they talked about. The final theme then is being strong as a team, sharing the caseload and supporting each other. All viewed shared care as protective and helped them to set boundaries, allowing them to step back when they needed to. They also talked about the importance of being team players and sharing the heavier cases. One nurse talked about the emotional impact of being all things to all people when she initially went into palliative care and wasn't able to establish boundaries that well. And she talked about the importance of being emotionally aware and being able to establish those boundaries so that you don't, the emotional effect isn't negative on you. Supporting each other. This was kind of the main source of support for the nurses in this group. Debriefing with colleagues was their main way of debriefing, because they were talking to people who understood best the situations that they were in. And it helped prevent them feeling very isolated as home care nurses. They also emphasised the importance of being able to access medical advice and the importance of the multidisciplinary team meetings for formulating plans of care and providing a learning environment. But they also talked about some of the challenges of working as a team, and I suppose if there isn't cohesiveness within the team, that can impact on the resilience of the individuals on the team. So just to conclude then, the commitment of participants to their work and making a difference for patients was their main source of affirmation, but it shouldn't be taken for granted. Acceptance comes with experience, so new staff may struggle with this and may need to be supported by colleagues and managers. The Point of Care Foundation advocates that management and staff should have very clear goals, values and processes, so there's no ambiguity. And that includes educating service users to minimise unrealistic expectations. Nurses emphasise their need to keep up to date through formal and informal education, and that can be negotiated at local level. Shared care appears to be protective for nurses, and that could be considered by teams that don't use this system. But again, it should be monitored by a team leader to make sure that nurses aren't becoming too entrenched. The team operates as the main support system, so it's important that the team would be cohesive and would work well together. Management can play a role in helping to foster a strong and supportive team environment, particularly during times of change. This was a single centre, small, purposeful sample of community palliative care nurses, so it's not representative of all community palliative care nurses or generalisable. And just in terms of recommendations for future research, maybe a comparative study with rural nurses or a comparative study with other members of the multidisciplinary team to identify similarities or differences in strategies and supports that enhance their resilience. The other thing I think the study doesn't reflect the impact that resilient practice has on patient care. I mean, if you have nurses that are coping a lot better in their work, surely that must help our patients. Thank you.